This is the Restorative Medical RestAir Hip. It's a wonderful device. We treat hips for several reasons. It's not just for pain. It's not just because people's knees are getting closer together. There's the practicality of it that if your knees are together or you're scissoring, then it's very, very hard to keep your peri area clean. And most of these patients are going to be incontinent of bowel and bladder. That means they don't have control over those functions. So they have to be continually kept clean and dry, or they'll be prone to all kinds of irritations and skin breakdown. So it's very important to get airflow to that part of the body, and you want to keep the hips in alignment. When they start to go in, it's very, very hard then, and typically you'll have knee contractures also. It's very hard to position your patient in bed to where they don't get wounds. It's harder to keep them on their back. Their knees are up and they'll tend to slide one way or the other. If your back is straight, then you're going to torque the torso. Then you'll end up with curvature of the spine. It's like a snowball rolling downhill. So if we can catch those hips before they get totally adducted, that's wonderful. Also, to sit people up in a chair, and people need to sit up at 90 degrees in a nice straight back chair, like a wheelchair, not in a reclined jerry chair. In a reclined chair, you might as well be in bed. You're still laying back. This is immobility, which leads every body system to become unhealthier. You have to set up for all your body systems to work, to breathe adequately. And we don't always think of hips being that important for your whole body health, but it definitely is. These people, that tone will kick in their hips and they'll slide out of the chair just like a surfboard. They stiffen up and slide out. With this, you're going to continually allow the hips to work through that tone and spasticity to keep them relaxed. So it should be a big part of your falls prevention and of your seating and positioning. This, with our Vertebre's TLSO, that corrects posture of and positioning of the torso, these two together do a wonderful job of seating positioning, and then you don't have to, the nursing home or the family does not have to purchase things to try to push in the chair to prop their patient up, their loved one up. You're going to actually correct their body and keep them in good alignment very comfortably and safely. Now, these come in pediatric version, and in adults we have small and large. If you have a very large thigh, then you can order an extra large. We also do extenders where it just attaches how you can let us know how much larger you need this, and it will extend it out. But again, with Restorative Medical, if you don't see it in our catalog or on our website, assume we make it, or we'd be happy to. We want to totally help you take care of your patients. Now, you can adjust the length of this. If you have patients with shorter thighs, you can adjust it back, or patients with longer thighs, you can make it a little longer. This actually, if my arms were legs, you would see this would fit under the patient. You just slide these under and their legs are extending out. You're going to pull this up high enough that where it's comfortable. Now, if they are incontinent, you want to make sure they have on some type of adult attends to protect this from getting soiled. You don't want to wash it any more than is necessary. You want to protect these. They're reimbursed by insurance, so we want to protect them and help them last as long as possible. In order to fit some patients with severe scissoring or severe adduction, I know I had a patient one time that was crossed at the thighs and her femurs were so tight together. If her urinary catheter got between those bones, it cut off the flow of urine. So this can be amazing. You can't just pull their hips apart. You might pop that hip out of joint and do some permanent damage. You might hurt them. These people tend to have osteoporosis, weak bones, because of their immobility, and they're not doing weight-bearing exercises, which helps maintain the minerals in the bone to keep them healthy. So it's very important that we're very careful with these people. And at first, you may just slide just this material between the knees. Just start it down. The patient would be here, their knees are here. Just start it gently, coming up into their mid-thigh. Then as you want to increase the amount of adduction, this comes with the RestAir hip. So this would be a plastic bar. I'm going to show you in a minute. And these are, it's very adjustable where you can take the patient farther and farther. But first we're going to show you how to take care of that really severe patient. You may actually have a patient that you can go ahead and pump this up and put this on immediately. It's just a lot of tone, and you have caught them. They have lost range in their hips, but they're not so awfully bad, and we want to catch them as soon as possible. But if the patient is very severe, this is what you would do. And you want to hold the tip, because you don't want to loosen this tip from the black material. So you hold that tight, and you insert, if you forget that it's the clear end, you just blow on your face and you realize which one pumps the air. You twist that in and you inflate it. Now this is not orthopedic, so we don't have to be terribly precise. You want to look at your patient, you want to watch their facial expressions, you want to feel their body to see when they tense up, if they're in pain. If they tell you they're in pain, then you assume they're in pain and you go no further. But this is very gradual. And again, I'm going to hold the tip and I'm going to pump it up. You can count the puffs if you want to, or you can just visualize it. I just visualize it. And you slide that back in and tuck it down. Now what you're doing, see, I'm just gradually putting a little air in, but you're starting, the 4 air bladders are securely sewn into chambers. It's not something that's going to pop off or you're going to lose them. You can't have pressure, because any potential pressure is dispersed over the entire length of the inner thigh. So it's very comfortable. Your thigh fits here. It takes on the shape of your inner thigh. And you just continue to pump it up until you reach the degree you want. And for time, I'm just going to pump it up that much. After you pump up enough, it's going to be about to this extension, and that may be enough for some of your patients. You want to have them comfortable but seated upright in the chair. It's also wonderful if you take the plastic out, you can use this in bed. Rather than trying to put a pillow between their knees that's always going to scoot out, it's going to be at the foot of the bed or whatever, on the floor. This will stay up by wrapping this around their thighs. It will stay in place, so your patient is side-lying in bed and they're very comfortably kept in adduction. You just want to make sure the feet are in proper alignment too, so you would put something between the feet, like a pillow or whatever, because you don't want your knees here and your feet going in. It's just a matter of common sense. You want to always step to the foot of the bed before you leave your patient in that bed. Look at their body. Are they in appropriate alignment? Is there something you need to do to them to try to get them as you would see in a picture in an anatomy book? That is not going to be possible with many of our patients, but you always think that and try to progress them toward good alignment. Just poor body positioning can lead to shortened tissue and contracture deformities. So it's very important that we keep our patients' torsos correct in bed or in the chair as much as possible. Okay, we have let's assume we've pumped up all 4 air bladders as much as they're going to inflate. We want to take the patient a little farther. We simply pop this in, and still you get your good fishing pole type of stretch, that tug and push back to relax the tone. This plastic cannot be felt by the patient because you have not only all this padding, but you have the air bladders there. So you can't have any potential pressure like with some of the rods that you see on some devices. If you want even further extension, you would take with a drill or a screwdriver. It's much easier with a drill, and you would take both of these bolts out and put this one in and screw them back in. They're self-threading. Even further, you would take this one. Now, we sometimes have therapists that want to do pelvic stretching, and if you'll let us know, we'll make this bar as long as you need it, and we're happy to do that. Also, we have some therapists that want to stand their patients with the RestAir Hip on. We're also happy to do a little belt that velcros down that will hold it from sliding down, because these are really designed more to be worn in the chair and in bed. But whatever you like to do that you feel is best for your patient, if you'll let us know, we're more than happy to work with you and meet you and your patient's needs. Thank you.